Good afternoon, everyone. I want to thank you for joining us so late in the day. I wanted to talk today about Botox and fillers and their complications. This is something that is near and dear to my heart. I love to treat patients with Botox and fillers, and I think that it's one of the things, although it's not a huge part of my practice, it's something that I love to do, and I feel like it makes an important difference in patients. And nowadays, patients have a lot of options. A lot of people are injecting, and you want to make sure that you're a good injector. A patient is coming to you to improve their appearance, and if you're leaving them with a side effect or a complication which sometimes cannot be avoided, then you're doing them a disservice. So the best thing you can do is really try to avail yourself and train yourself as well as you can to become familiar with good technique and the way to avoid any problems that might come up and how to treat those problems if and when they do come up. Okay, so I have no disclaimers. We're just going to be talking about Botox. We are going to be talking about some off-label uses of the Botox, as you all pretty much are familiar with. It's really only approved for the glabella, but it's been used extensively in other areas of the face. Botox is everywhere, and even on the way and in the White House. I myself was pretty surprised. I was watching the vice presidential debates, and I saw Biden, and I said, you know, something's wrong. And I looked at him, and I said, you know, I immediately thought, am I the only one that's noticing this? Something's wrong when he's speaking and so forth. And I thought, gosh, is that Botox? You know, something's gone wrong. If you look at him on the close-up, you can really see on the lateral aspect, he was under-injected, so he's getting that kind of raised lateral brow. So especially when he was talking, you could really notice it when he was expressing himself. And then we have John Kerry. He actually had a little bit better Botox. In men, you want to inject across the whole forehead. You don't want to give them a raised eyebrow. In women, you can raise the eyebrow a bit because it gives you a more natural arched look. But in men, you want to inject across the whole forehead. But you know, also our celebrities obviously are victims to bad Botox. But I guess this goes to show that even with bad Botox, you can make it to the White House. So we're going to talk about a little bit of the common complications of Botox. One of them is not treating enough, but I don't really consider that a common complication, especially early on when you're learning how to do Botox well. I commonly have my patients come in after 2 weeks just to recheck them. I don't do injection by unit. I do charge them by zone. I feel that the patients feel more comfortable with this. We tell them, look, this zone is X amount and your touch-up is at no charge. Yes, there is some variability. Some patients require more units than others, but I think it's really a washout, and it's more, they can really comprehend that easier than saying, oh, it's, you know, $12 a unit or so forth, whatever it is. So for me, the approach of per unit is a little bit better. And when you're first learning, I would encourage you to undertreat and then touch up. I would say that my touch-up rate is probably about a 20 to 25%, and I like that rate because I don't want to give them that frozen look. And we're going to be talking a little bit more about these, but these are the more common complications you get. Ptosis of the eyelid, a complication that can happen really to anyone, even the best injector. I've been to many conferences teaching, and you all may be familiar with Fred Brandt, who is the #1 Botox injector in the country. He's based out of Miami, and he says basically that everyone, even he, will get a ptosis from time to time. So it will happen, even if you do the best technique that you know of. Asymmetry, also something that can be easily corrected when the patient comes back, and you can just see, because sometimes you'll see initially that the Botox will absorb not evenly, especially in the first few days. It really starts kicking in day 2, day 3, and you'll see some asymmetry, but then it will even out. But after the 2-week period, really whatever's happened is going to happen, and then you can correct it. Bruising is something that all patients can experience, especially around the periocular area. If it's a patient, which I have some patients that are like newscasters or they're in the public eye, you want to make sure and take extra measures for those patients. So sometimes those patients, I'll ask them to go and get some arnica and pre-treat themselves. I'll make sure that they're not on any vitamin E, that they're not taking any Motrin, that they're not taking any aspirin pre-treatment and post-treatment. And we'll talk a little bit more about these as we go, but also there's perioral droop, and you say, well, you know, we're going to talk about where we inject, but that can happen even when you're injecting around the eye, where the medicine will migrate down to the zygoma, the zygomatic muscles, and cause a droop around the mouth, and unrealistic expectations. My approach with patients is always, you know, you're going to have an improvement, but you're not going to be perfect. And I think the under promise, over deliver is a great approach when it comes to cosmetics. In my practice, I have about a 95% retention rate for Botox patients, which I'm very happy to have, and I'm very grateful that my patients are satisfied with my treatment. But that's something where, you know, you start them slow. A lot of times when a patient has not ever had Botox and they just say, just do everything, I say, look, you know, let's take it slow. We'll do the glabella. If you like it, then we'll add the next thing. You're coming back in 2 weeks anyway. We'll do more then. And you ease them in. Now, you know, usually what happens is that they come back and they want to do a new zone, and then they just want to stick with you every 4 months and they're doing everything. But the first time patient, I'm not that eager to do all, you know, the major zones, which are the glabella, forehead, and around the eyes. And there are other areas which we'll also go into. Now, Botox has had a pretty couple bad years. In 2005, there was animal-grade Botox. This actually happened pretty close to my house in Fort Myers. I think it was in the Sarasota area. What happened was that there was a company that got hold of some animal-grade Botox, and they faxed all of the dermatologists a flyer saying, you know, you can get this Botox at, you know, I don't even remember what the price was, but it was a lot less than the normal price. And a lot of dermatologists and other physicians fell into this and bought this Botox. Well, one of them was this physician in the Sarasota area. And y'all have probably heard this story already, but he injected himself, his wife, his best friend, and the wife of the best friend, and they all ended up in the ICU. Because what happened was that they got animal-grade Botox and tried to dilute it down. Well, you know, we've all taken basic chemistry, and you can't just throw something into a bottle and shake it up and it's going to be uniform throughout. So some of these patients that got this animal-grade Botox from other physicians did fine because they got lucky. But these guys ended up intubated, and there was nothing that could be done. Well, they ended up, you know, having criminal charges brought against them. But this is something that, of course, brought a lot of fear into the hearts of our Botox patients. And, of course, whenever a story like this hits, we hear a lot about it afterwards. Oh, my gosh, Botox can kill me. I'm going to end up in the ICU. So you have to be ready and be on top of what's happening in the news and be ready to address these issues.